Hey, welcome to Mihiraa. We have the 5 nursing competitive questions of the week. Question number 1. A client, Mr. X, who has been receiving urokinase has a large bloody bowel movement. What nursing action would be best for the nurse to take immediately? A. Administer vitamin K. B. Discontinue the urokinase. C. Reduce the urokinase and administer heparin. D. Stop the urokinase, notify the physician, and prepare to administer a Mihiraa. Answer D is correct. Urokinase is a thrombolytic, used to destroy a clot, following myocardial infarction. If the client exhibits overt signs of bleeding, the nurse should stop the medication, call the doctor immediately, and prepare the antidote, which is a Mihiraa. Answer B is not correct, because simply stopping the urokinase is not enough. In answer A, vitamin K is not the antidote for urokinase. And, reducing the urokinase, as stated in answer C, is not enough. Question number 2. The patient X is prescribed metronidazole, Flagyl, for adjunct treatment of duodenal ulcer. When teaching about this medication, the nurse would say, A. This medication should be taken only until you begin to feel better. B. This medication should be taken on an empty stomach to increase absorption. C. While taking this medication, you do not have to be concerned about being in the sun. D. While taking this medication, alcoholic beverages and products containing alcohol should be avoided. Answer D is correct. Alcohol will cause extreme nausea if consumed with Flagyl. Answer A is incorrect, because the full course of treatment should be taken. The medication should be taken with a full 8 ounces of water, with meals, and the client should avoid direct sunlight because he will most likely be photosensitive. Therefore, answers A, B, and C are incorrect. Question number 3. The client Mrs. X with brain cancer refuses to care for herself. Which action by the nurse would be best? A. Alternate nurses caring for the client, so that the staff will not get tired of caring for this client. B. Talk to the client and explain the need for self-care. C. Explore the reason for the lack of motivation seen in the client. D. Talk to the doctor about the client's lack of motivation. Answer C is correct. The nurse should explore the cause for the lack of motivation. The client might be anemic and lack energy, might be in pain, or might be depressed. Alternating staff, as stated in answer A, will prevent a bond from being formed with the nurse. Answer B is not enough, and answer D is not necessary. Question number 4. Client X arrives in the emergency room with a bullseye rash. Which question would be most appropriate for the nurse to ask the client? A. Have you found any ticks on your body? B. Have you had any nausea in the last 24 hours? C. Have you been outside the country in the last 6 months? D. Have you had any fever for the past few days? Answer A is correct. The bullseye rash is indicative of Lyme's disease, a disease spread by ticks. The signs and symptoms include elevated temperature, headache, nausea, and rash. Although answers B and D are important, the question asks which would be best. Answer C has no significance. Question number 5. Isoniazid INH has been prescribed for a family member exposed to tuberculosis. The nurse is aware that the length of time that the medication will be taken is A. 6 months, B. 3 months, C. 18 months, D. 24 months. Option A is correct. The expected time for contact to tuberculosis is 1 year. Therefore, answers B, C, and D are incorrect.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.